Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about one of the neuroprotective treatments, one of the nutrient treatments for managing the symptoms of peripheral neuropathy. This is the most common treatment that's used as far as vitamins are concerned, and actually is very effective for specific reasons. So I want to talk to you a little bit about this. This is vitamin B1 or benfotiamine. Now, vitamin B1 technically is thiamine. Thiamine is the active form of vitamin B1, but it is poorly absorbed and poorly utilized by the body when taken orally. The problem with this is because it's not absorbed, because the bioavailability, which is poor absorption, bioavailability is very, very poor. Taking a supplement of thiamine typically has no beneficial effects. That's why it is recommended that you take benfotiamine instead, because the body can utilize this and it modifies benfotiamine after absorption into thiamine, which can be utilized by the body. So why is the thiamine important? Well, it's essential for converting carbohydrates to energy. So it basically takes the carbohydrates and turns them into the energy that can be utilized by the cells. And it is most important in maintaining normal, healthy nervous tissue, the nervous system, brain, and even the heart. Studies have been shown that benfotiamine taken in supplemental form has just as good effect as if the thiamine is already in the body. So it actually is being absorbed really, really well and is able to be utilized to create those beneficial effects. And it has been shown to be beneficial in individuals that have a deficiency in thiamine, but it's also been shown to be beneficial even in some individuals that are measured to be normal in their thiamine levels, because it's neuroprotective. So on an individual nerve cell, it actually is beneficial in preventing nerve damage by treating the cell at the mitochondrial level. As we talked about in some of our other videos, the mitochondria is one of the areas where the injury can happen, and that will cause the nerve not to have the energy or not have the capabilities necessary to create the proteins or to repair the cell itself. Benfotiamine can help prevent that damage to the mitochondria, which allows the cell to regenerate, allows the cell to function like it's supposed to, gives it the energy that is necessary so it can continue to do the essential activities of a nerve cell. So it is very, very valuable, and most of the time I recommend that this vitamin be utilized by all individuals that have peripheral neuropathy or even have the risk, say in a diabetic, of having peripheral neuropathy. Although there are no studies that say that it will be beneficial in chemotherapy type treatments that may cause peripheral neuropathy, I would have a tendency to say let's try the vitamin B1 as long as it doesn't interact with the medications or treatments that are being done. So what's the recommended dosage? It is important to understand with vitamins that you have some that are water soluble, some that are fat soluble. In a water soluble vitamin like vitamin B1, it needs to be taken periodically because it's washed out of the system. It's recommended that this be done twice a day because that's when it seems to have the best effect. Dosage is 150 milligrams to 300 milligrams a day, again, taken twice a day. So you're gonna take maybe 150 in the morning, 150 in the evening, or 75 in the morning, 75 in the evening to get the benefit of the 150 to 300 milligrams a day. In some of the treatments that we initiate, we kind of double up the treatment initially to try to get the levels of vitamin B1 appropriate, and then you can reduce it to half the dosage after using it for 2 or 3 weeks. There are also food sources of this vitamin. However, my recommendation with peripheral neuropathy is that you use the vitamin form, the supplement form, and use the food sources just as supplemental, as additional. So what are the common things that can, nutrients that can be, food sources that can cause this nutrient? Cereal grains, oatmeal, flax seeds, sunflower seeds, brown rice, and some of the asparagus, spinach, green peas, kale, cauliflower, potatoes, stuff like that. You can find them in oranges. You do find it in liver, especially beef, pork, and chicken. You can find it in soy milk and in eggs. So vitamin B1 is pretty well utilized if you have a good amount of green leafy vegetables, for example. If you have the cereal grains like oatmeal, flaxseed, even some of the wheats and so forth, you can actually get a lot of vitamin B1 in those situations. So vitamin B1, benfotiamine, is a very valuable supplement that should be utilized by just about anyone that has peripheral neuropathy to help you manage the symptoms of peripheral neuropathy. And like we said, it is neuroprotective as well, so it can prevent further damage. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 38.